Hello and welcome to this short presentation entitled Vet Advice on ClipFitter and What Do We Currently Know. This is a re-recording of slides that we presented at the Sheep Veterinary Society in May this year, and we just wanted to make the content more widely available and so decided to re-record the same slides. So I hope that there is something here that is of interest and useful, particularly to vets in practice. My name's Tim Geraghty. I'm a farm vet and independent vet consultant working in the northeast of Scotland. Since summer 2025, I've been working as an independent advisor to ClipFitter. And that work has largely entailed speaking to vets and farmers that have used the system and understanding their experience, and particularly if they've had any negative experiences with them, and trying to collate them, study them, and understand any lessons that can be learned from them. And so what I would hope to share is my learnings from that so far. And as I say, I hope that would be useful. Just as a very quick reminder of the timeline of development, so the product ClipFitter was developed in the years 2018 to 2022, started as a research project at University of Edinburgh and with sort of commercial backing, if you like, and then underwent two formal trials, both run by SRUC. All of that evidence was submitted to the Animal Welfare Council in 2022, who went on to recommend allowing the use of the system across industry. And so since 2022, it has been available commercially. And so over that window of time, the sort of last 3 and now 4 years, there's been increasing use on farm. There has been ongoing development of the system and the support, and my role, as I've said, over the last 1 year has also been to try and better understand the sort of veterinary aspects of the system. And essentially the text on the right there is just giving the real very shortened headline findings from the trial work done to date, which is that ClipFitter consistently induces a lower pain response for both castration and tailing, and that lesions are equivalent or better to those caused by rubber rings. I don't think it was ever envisaged that there wouldn't be complications with using clips. This is quite an invasive thing to do to a young lamb, to have quite a vulnerable animal, and I don't think anyone thought that they would be used risk-free. I hope they've never been presented as being a risk-free option. They're certainly not. Same as any method of castration or tailing, there are risks involved. And so a big part of the sort of industry rollout was to continue the monitoring of any adverse reactions and make sure that lessons are learned and that we fully understand this system. And I would say that work is ongoing, and that's partly what I've been trying to help with, is collating those reports of adverse issues and, as I say, studying them and trying to learn from them. Just more on that, I guess, important to place it into context. So I would think it's reasonable to say that all forms of tail docking and castration carry inherent risk. I think as vets, we should, as far as possible, be supporting and promoting sheep systems that don't require castration and tailing, and there are really good examples of those systems working very, very well, and I would hope that those systems continue to grow in kind of popularity and uptake, because that's clearly the best possible outcome for the welfare of the lamb, and if that can be made to work in the broader system, then all the better. That said, I think it's reasonable to say that for a lot of reasons, castration and tailing is likely to continue for the foreseeable future, and all methods, regardless of how we do it and at what age, are likely to carry risk because they're quite invasive, traumatic experiences ultimately to do these things, and so they do carry risk. That includes rubber rings. They are very, very commonly used. We've all used them previously, and we've probably normalised to some extent some of the risks that come with rubber rings. And the images here are taken from the paper as referenced below, but it's just a really good reminder that the rubber ring system is not risk-free either, as well as being associated with high levels of acute pain. They're also associated with secondary complications. Clipping is novel and more complex, especially castration with clips is more complex than fitting a ring, and we need to be mindful of that. It's also new, and so everybody that tries it is a novice user. You're not likely to have a very experienced neighbour helping you out, and so the sort of error rate is higher when we try a new and more complex system than something that we're already used to. So I think that's relevant when we're thinking about adverse reactions that we've seen over the last few years, that there's essentially a higher initial error rate. And then the last thing is just to bear in mind when we look at the reported cases that there is a risk-benefit balance to be kept in mind. So what I'm very confident to say is when I speak to vets and farmers, even those that have had a negative outcome or a problem of some kind, they will very consistently report better acute pain behaviour. So much lower acute pain behaviour. That's been shown in the trial work. It's been validated, in my view, by in-field experience now, where it's consistently observed. And so when there are complications, even when there are complications, sometimes some users are still seeing an overall balanced risk benefit. So to sort of validate that, about a third of people who have reported an adverse reaction are still using the clips. And so, yeah, it's just to keep in mind that when something goes wrong, firstly, it's not always completely catastrophic. Sometimes it can be rectified fairly easily, and there is always that risk-benefit balance to be kept in mind. But as I said at the start, no system is risk-free, and the best vet advice we could give is to encourage more systems to go to non-castration and non-tailing. Just to look at what we've learned over the last year, so this is estimated incidence of reported adverse reaction events to ClipFitter. So I think all of these figures must have a very wide confidence interval, and so please don't take them as absolute gospel truth. They're the best estimate that we can make with the information we have available. This is passive surveillance, so denominator figures are difficult to obtain accurately, and underreporting is very likely, particularly probably for less severe cases. So we don't think that everybody that's had a problem has been in touch. This is about farmers voluntarily or vets voluntarily contacting the company up until now to report a problem, and so underreporting is quite likely. So those are the caveats, but basically the figures would show roughly on-farm use is somewhere around, and this is up to the end of 2025, so it'll be higher than this now, but 176,000 tail docks and 87,000 castrations on farm. From them, up until May 26, we had 34 reports of an adverse reaction. So ballpark figures, about 5% of new users and 0.5% of lambs clipped have had some kind of problem. The reported incidence, so how many lambs affected, it's a lower number of cases where we could determine that with certainty or accurately, but there's a wide range, so it's from less than 1% all the way through to almost all lambs affected. But if we look at the distribution of that, it is, most cases are a small, almost half the cases are a very small number, so less than 10%. Less, the vast majority is less than half the lambs, so you do get these ones with sort of moderate incidence, and then occasionally, and some of those have been quite high profile, and there's been much higher number of lambs affected, but that has been the minority of cases reported. When we look at what is being reported as the problem, there is quite a range, and this is probably an oversimplification, but to try to categorize them, to understand them quickly, there's certainly some that would categorize as user error, and we'll look at them in a second. A big chunk of them are infection or fly larvae infestation of the clip site, particularly on tails, and then another large proportion are scrotal edema following fitting of a clip. So we'll go through those three in a bit more detail. Starting with user error, so these can be, range from very minor through to fatal, and as I said, everyone is really novice at this stage. Even the experienced users maybe only have 2 or 3 years behind them. So they're probably occurring at a higher rate now than they would do had we all, once we've all gained more experience, these are likely to reduce. But things that are repeatedly reported, so skin trauma, so catching the skin of the inner leg in the teeth of the clip, that's very common. It's quite minor, except that it's another potential for secondary infection, and in a young lamb, that clearly can lead to joint ill. So it shouldn't ever be ignored, but in many cases it'll be quite minor and recover uneventfully. Catching the testicle in the clip is quite common, especially the sort of testicle further away from the closing handles of the tool. Seems to be the one that gets caught, and that can cause an immediate pain response and an increased risk of edema. Using the wrong size of clip is common, and that's something that I think is, it's obviously a bit frustrating because it's entirely preventable. We've got these ready reckoner tables that ClipFitter have produced, and if anything that vets can do to help is, one of the first things is just make sure they're using the right size clip for the age and weight of lamb, and particularly with the bio clips, which are much more popular because they biodegrade, but they are softer, they're a less hard material. We really need to stick to those upper limits quite rigidly, and if in doubt, move a size up. I think it's probably really good advice. Leaving a rig, same as with a rubber ring, that can be done, and the same advice as we would give in terms of rubber rings. And then one that's definitely been documented and can occur and has occurred in multiple cases is trapping the urethra with the clip, and obviously that is catastrophic for the lamb. It's reasonably easy to avoid. It is easy to avoid. It's not common, but a little bit of forewarning and training about location of the urethra in relation to the scrotum can make an awful big difference to the risk of that happening. So general vet advice here, starting with a small number of lambs, making sure that you've reviewed all available training material online, working with a buddy, especially if that buddy's done a few themselves beforehand and feels confident, would be a big help. But even if it's just a second person and a second pair of eyes, be ready for this feeling more fiddly and being more complicated and complex, especially in the first few that you do, and especially for castration. I think that's reasonable, and the expectation should be it takes some time to learn this. And check the clip immediately after applying, because some of these issues can be identified and rectified or treated straight away. And I've got a short clip later just to go through what can be checked. But that idea of not just clipping and moving on as fast as possible, but taking our time to check the clip site straight away is probably wise. The second big group is infection or fly larvae infestation. So these are much more commonly reported on tails than on scrotum. It's probably a dirtier site. They're not commonly reported, but when they are reported, more on tails than on scrotum. And the same as anything that causes, bacterial infection in the lamb, there's very likely, just on first principles, there's likely to be a much higher joint ill risk secondary. And we definitely have seen that where we've got infection of the clip site and then secondary joint ill cases occurring. So yeah, these are probably more easier to understand, or at least the pathophysiology of it is familiar to us as vets. It's similar to, as we can see with tagging young lambs, and as I've shown already, similar to what can happen with rings. And so the general advice around colostrum uptake, hygiene, the lamb being dry, being placed in a clean, dry environment is all very, very relevant. I would probably encourage using gloves and thinking about hand hygiene. It's very difficult to prove. We know hand hygiene is extremely important in generally in joint ill outbreaks, and I have no reason to suspect that it's not equally as important when clipping. And so I think putting on gloves is a really good visual cue that we must do this as a clean job. And just thinking about what our hands have been doing that day, lambing ewes would be very high risk. Sorting feet, dagging ewes would be high risk. If our hands are dirty, then it's really not ideal. I think skin disinfection of the clip site's a really good idea and should be recommended, especially when starting out, using something like iodine or Novax or whatever, as we would often recommend with ear tagging young lambs. I think the same should apply at least to the tail. Applying fly control if it is the high risk season, again, really important, absolutely kind of unmissable, because fly larvae infestation does happen and can probably be prevented in the vast majority of cases with good preventative care. Two last things then. One, finding the intervertebral space. That can be a little tricky in younger lambs, but just gently moving the clip up and down the tail until it nestles into a soft tissue space can make a big difference, because we do less sort of bony damage. And I think a really important one is leaving tails longer. So there is prior evidence, and I've got the paper at the here, that dock tail length is a risk factor for joint ill. So we know that shorter tails are higher risk, and that, in my view, from what I've seen over the last year, it feels likely to be the case with clips as well. That where we've seen particularly high incidence of tail infection and joint ill, I think a reasonably common factor appears to be quite short tails. I don't think there are any veterinary reasons to take the tail too short. There's obviously a legal minimum that must be adhered to, and as far as I'm aware, leaving the tail even down to the length of the hock still gives you the benefit of reducing the fly strike risk in later life. And I can't think of any vet reason to go shorter than that. There appears to be sort of aesthetic and breed society encouragement to go shorter than that in some cases, and I think that, again, vet advice should be against that, to leaving the tail longer, and there's certainly good published evidence and anecdotal evidence that that would help to reduce the risk of infection. And then the third big group is this scrotal edema. So here, obviously talking about the castration now, so the clip's been fitted, and what appears to be happening is that you've got incomplete occlusion of the arterial supply, and therefore you get scrotal edema in a period of time afterwards. The swelling can be variable, so you get mild cases, which probably the photographs are showing a mild case, but it can be moderate and more severe. It can be associated with pain, but not always. So sometimes they appear perfectly comfortable despite the swelling, but in other times there seems to be some residual nerve function and pain, unfortunately. And in very severe cases, you can get scrotal rupture, probably either from trauma of the distended scrotum or from just a direct sort of sloughing and opening up, and obviously, thankfully, that is very, very rare, but when it happens, it's quite upsetting because it's a pretty major lesion and not good. So in terms of how do we prevent this from happening, so one major one similar to that, as we talked about in the user error slide, avoiding catching the top of the testicle. That's a sort of a technique. It's a technique thing, and just getting better at applying the clips certainly will reduce the risk of this. Ensuring a really good crush, so the applicator, the pliers that we use to apply the clips are not just to put them on, they're also to help make sure the crush is good, so it is a modified Burdizzo, and pausing with the applicator closed for a slow count of 5, probably just make sure that the artery is properly crushed before we remove the pliers. Checking the clip straight away that it's fully closed, that there's no wool or skin, excess wool or skin, trapped in the clip and causing that clip to open up or have pressure on it. And I think this is really important, again, when we're doing our first few lambs, if at all possible, do small groups, leave them somewhere they can be examined again 12 to 24 hours later, and just double check that it's not occurred. So it will be obvious after that sort of time, and we can intervene very easily. So the clip should be removed and another clip applied, and in my experience that is usually very, very effective. Or if needs be, an alternative castration method used, but if it's identified early, it can be treated fairly quickly and hopefully uneventfully. But the main goal of the check at 24 hours is, is that immediate feedback loop, so that we know that if it's occurring, we need to figure out why it's occurring, alter our technique to make sure that it stops, that we can stop it. And I think I mentioned earlier, making sure the clip size is correct and that we're getting that good crush. I've got a short clip here which I'll play. So this is just about doing that immediate post clip check. So I'll just play this. So the lamb's having a clip applied, so making sure that the technique's good, both testicles fully in the sac, not catching the teats either side, well clear of the penis, and then that pause and a slow count with the pliers on. And then once the clip's been applied, before that lamb is released, just double checking teats are outside, 2 testicles are in the sac, nothing crushed, nice and free moving, and then the penis is well clear, just moving the urethra through the fingers there, and then he can go down. And some of those user error issues can be picked up straight away and rectified if needs be. And then, as I say, re-examine that same lamb in the learning phase, re-examine that same lamb 12 to 24 hours later and just make sure everything still looks good. Conclusions then. So as we said at the start, ClipFitter can reduce the pain associated with castration and tail docking. Vet advice should be to move to systems that don't do this at all, but in systems that can't get there now, there is an option here that can reduce the acute pain, but the process is more technical and is not risk-free. And I think all of us as veterinary industry should be stressing that yep, there's a possible benefit here, but it's more technical and it's not risk-free. And as I said at the start, we're definitely still learning about what those risks are and how to mitigate them effectively. I think at this point, vet advice can definitely reduce risks. And that's the hope of recording this talk, is that to empower others to help to do that. And that's really about knowing the common issues as we've covered them, advising clients on first principles, and hopefully we've covered. And I think training material for vets probably does need to improve, and that's something I'll continue to advise to ClipFitter to try to improve, overall veterinary understanding of how the system works, how to do it, and how to mitigate some of these risks. Just to finish then, I think, the only reason we've learned, or we've got this presentation today is thanks to the farmers and vets that have both tried the system, and if they've had an issue, reported that and come back. So continued reporting, I think, is really important. This is still very new. We're still learning. Its use rate is still increasing, and I think as a sort of, as we try to support industry to gain the benefits of this, we've got an important role to play in helping industry learn about the risks. And so I would really encourage ongoing reporting of all cases while we learn. In Scotland, that's now done via the surveillance network with SRUC. So they've got a dedicated reporting route for all methods of castration and tailing, not just clips, but any other method. And so if we do come across cases, then please ensure that's reported to SRUC in Scotland. And in the rest of the UK, it would be reporting directly back to ClipFitter. And as I say, my role currently is to collate those reports, ensure they're investigated as best as possible, and keep tabs and try to learn from them over time. So that's us. Just a huge thanks to all of the vets and farmers who have reported cases. That's where this initial knowledge base has come from, and we're just extremely grateful for the people that have given up their time to document what's happened on their on their farm, and as I say, to share their experiences. So a huge thanks to them. I hope this has been useful to you, and as I say, I hope to also, as our knowledge base increases as a group, we try and keep sharing that information to vets to allow us to be as skilled and knowledgeable in this as possible. Thank you very much.